Prednisone is used alone or with other medications to treat the symptoms of low corticosteroid levels, lack of certain substances that are usually produced by the body and are needed for normal body functioning. Prednisone is also used to treat other conditions in patients with normal corticosteroid levels. These conditions include certain types of arthritis, severe allergic reactions, multiple sclerosis, a disease in which the nerves do not function properly, lupus, a disease in which the body attacks many of its own organs, and certain conditions that affect the lungs, skin, eyes, kidneys, blood, thyroid, stomach, and intestines. Prednisone is also sometimes used to treat the symptoms of certain types of cancer. Prednisone is in a class of medications called corticosteroids. It works to treat patients with low levels of corticosteroids by replacing steroids that are normally produced naturally by the body. It works to treat other conditions by reducing swelling and redness and by changing the way the immune system works. How to use? Take this medicine exactly as directed by a doctor. Do not take more of it, do not take it more often, and do not take it for a longer time that your doctor ordered. To do so may increase the chance of unwanted effects. Take this medicine with food or milk to avoid stomach irritation. Swallow the delayed release tablet whole, do not crush, break, or chew it. If you use this medicine for a long time, do not suddenly stop using it without checking first with your doctor. You may need to slowly decrease your dose before stopping it completely. Dosing. The dose of this medicine will be different for different patients. Follow your doctor's orders or the directions on the label. The following information includes only the average doses of this medicine. If your dose is different, do not change it unless your doctor tells you to do so. The amount of medicine that you take depends on the strength of the medicine. Also, the number of doses you take each day. The time allowed between doses and the length of time you take the medicine depend on the medical problem for which you are using the medicine. For oral dosage forms, dose depends on medical condition. Adults at first 5 to 60 mg per day. Your doctor may adjust your dose as needed. Children use and dose must be determined by your doctor. Contraindications. For short-term use for health reasons, the only contraindications is hypersensitivity to prednisolone or the components of the drug. In children during the period of growth, glucocorticosteroid shall be used only according to absolute indications and under the most careful supervision of the attending physician. Precautions. Before taking prednisone, tell a doctor or pharmacist if you are allergic to it or if you have any other allergies. The product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. This medication may mask signs of infection. It can make you more likely to get infectious or may worsen any current infections. Avoid contact with people who have infections that may spread to others. Consult your doctor if you have been exposed to an infection or for more details. Side effects. Side effects that you should report to your doctor or healthcare professional as soon as possible. Allergic reactions like skin rash, itching or hives, swelling of your face, lips or tongue, changes in emotions or moods, changes in vision, depressed mood, eye pain, fever or chills, cough, sore throat, pain or difficult passing urine, signs and symptoms of high blood sugar, such as being more thirsty or hungry or having to urinate more than normal. You may also feel very tired or have blurry vision, swelling of ankles, feet. Side effects that usually do not require medical attention. Report to a doctor or healthcare professional if they continue or are bothersome. Confusion, excitement, restlessness, headache, nausea, vomiting, skin problems, acne, thin and shiny skin, trouble sleeping, weight gain,